I've just been a normal kid my entire life. I grew up an avid athlete. I started t-ball when I was 4. I did cheer from the time I could cheer. And I went on the treadmill one day just to go take a run. I was at my local gym, and while I was running, doing something I've done every day of my life, I died doing that.
So about 2 weeks before he was going to go off to college, he was playing adult league with his dad like he usually does, and I went to this game.
We're playing, my son makes a shot, something went wrong, he collapses.
Everything that happened is just so fast, it's all a blur. They call 911.
One of the referees said, "Vern, I think we need to do CPR because I'm not getting a pulse." And so I said, let's go to work.
Before the CARES registry, we had no idea how often we responded to cardiac arrests. We had no idea how often bystanders were performing CPR. We didn't know how often a publicly available AED was deployed. And most importantly, we didn't know who was surviving to hospital discharge with good functional capacity. For any problem, you have to diagnose what's wrong before you can prescribe a treatment. So when you collect data and enter it into the CARES registry, it's like performing a system assessment. It'll show you the things that you're doing well, and it will also show you your opportunities for improvement, not just on an individual level, but from a system perspective.
Things that I hadn't realized were significant, all of a sudden I absolutely saw how significant they were. And exactly as everybody else has been saying, if you can't measure what you're doing and you can't ask the question of how are we doing, then how can you ever change it? How can you ever improve on it? And so that's what CARES did for us. It allowed us to see some numbers and then to really take those numbers and say, well, what do they mean? How do we get these numbers? And for the ones that we didn't like very much, how do we change this? We really started drilling down on what we were doing and changing what we were doing. And all of a sudden we saw some difference. And it was phenomenal to see the buy-in from the guys in the field and see their attitude shift. And when their attitude shifts, that's really the key, because then their actions will follow.
So I do have the honor of being the president of the National Association of EMS Physicians. Our membership is comprised of EMS medical directors from across the country, as well as EMS professionals in that same setting. I've been involved in CARES with the programs in which I'm involved since really just a few years after its inception, so quite a long time now. It's certainly helped us evolve as a system and to improve our systems of care. So the value of this is the measure and improve metric. All the members in our organization see the value in this, know that this is how they improve the health care, the public health aspect of cardiac arrest, and provide the chance for people to basically be reanimated to bring them back to life after suffering these events that happen in all of our communities.
There are a number of proven interventions to improve survival from out-of-hospital cardiac arrest that have not been utilized in an equitable fashion across populations. The three that I'm talking about are AED use, bystander CPR, and telecommunicator CPR. These three have all been validated with multiple studies, multiple populations. They don't break the bank, and they're things that have true impact in communities. And it's demonstrative improvement of 2 to 3 times increasing of the survival rate just by doing these small things. Part of the problem in getting there is the capture of data is limited to about half of the country, which is really great for most registries. But when it comes to something that's hyperlocal, like driving survival from out-of-hospital cardiac arrest, we absolutely need to know where to allocate resources and where to develop buy-in with local policymakers, decision makers. And the only way to do that is through telling the effective story and capturing the voices that matter. And that means expanding the reach of data capture.
If you look at our cardiac arrest survivors on Hilton Head Island, many of them were otherwise healthy. Many of them were relatively young. But because we made it our explicit goal to strengthen the chain of survival, we pulled them back from the brink of getting as close to death as you can possibly get. And that is very rewarding to an EMS chief, to a community. It's very gratifying to look back on my career and realize that that is the level of system performance that we enjoy here on this island.
Hawaii has been participating in CARES. We see the value. We are saving lives. And it's not just that one person. We are saving the family. We're continuing to work on it. We're getting better because Hawaii cares.
3 weeks after he got out of hospital, he was in school, and he finished his associate's degree, ended up at UCF, and finished his bachelor's degree, and he's living his dream up in New York as a film producer. He's doing his thing.
I work at a children's hospital on the cardiac unit now. I get to live out something that I thought was going to ruin my life, and has now changed it for so much better.
I understand and I know that cardiac arrest happens to anyone, everywhere, and it's the resources that make the biggest difference to survival. CARES matters because it saves lives.